transitional care coordinator, and my goal is to follow patients to prevent readmissions. My focus is always making the patient the priority and making sure the care is not just in the hospital, but once they leave the hospital doors, that their care is taken care of once they continue throughout their medical needs. I had one individual that's 32 years old, been to the hospital 70 plus times in the last couple of years.
Robbie came into the picture and started helping me out, staying out of the hospital, making sure all my appointments are correct.
I paired up with Variety Care to go through his medications and his treatments. I interviewed the individual in the room.
I think it was just, this was a patient that did not have a primary care provider, and because of our relationship with Integris Southwest, it was just kind of a natural process for them to refer him to us.
A lot of it was his medication non-compliance, and he couldn't afford the medications.
There was a lot of factors like no transportation, no job, unstable financially, and it was very hard for him to keep his medical appointments.
I was going through a little bit of a rough time with losing my mother and grandmother within a year apart, so I just, like a lot of things I didn't really stop caring about. Like for instance, my health issue, it really didn't matter, so I started doing a whole bunch of stupid stuff that I shouldn't have been doing.
And so I really wanted to concentrate on this gentleman to see if there's a root cause that we can fix on this individual. And once I got him established on a routine, it's like, okay, what can you do to help yourself? How can we get you to get these medications and all that? So I stabilize them and then educate them, teach them to take care of themselves.
He knows now how to take care of himself, and if he has any trouble getting his medication or getting an appointment here, he knows that he can call at any time and let us know, or let me know, and I will help him.
The last gathering that I got with my family, I think it was Easter, and they were all wondering where I've been, and I really didn't realize until then how much family, really much mattered, because it's like they missed me so much, so it just made me want to try harder, so that's what I did. I tried a lot harder.
Since then, this individual's lost probably about 80 pounds, not wearing his oxygen as much. The readmissions have gone down. Compliance with medications up. He's seeing physicians on a regular basis. So it's really, even though it's taken about 8 months, it's just taking that extra time, that other extra care in this patient.
My blood pressure's down, my diabetes is down, way down. I just feel like I'm getting better every day.
He may relapse, but don't give up on him once they relapse. You always care.
Not giving up is critical to this population because there are going to be many reasons, many problems. When you're dealing with people again that are underserved or uninsured, they're going to have many social and economic challenges that are going to prevent them from being as compliant with their medication regimens as we would like to. And you can get frustrated with that, and you can just want to say, well, I don't have time to deal with this. But I think that's the challenge that we have as a healthcare community, is that we have got to start thinking differently about patients. And within the context of the patient-centered medical home philosophy, is that the organization assumes responsibility for figuring out these things and helping patients get what they need, even when it's difficult.
I went from the bottom, I'm halfway there, so there's some kind of progress. I'm not gonna say I'm 100% because I'm not, but I'm getting there, And with his help, I'm gonna probably end up getting there all the way.
When I first came into nursing, I took the oath to love the sick. And it doesn't matter if they're non-compliant, compliant, rich, poor. I just want to help people.